Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series 46. RNA is nothing but random questions in neurology and neurosurgery with answers given by Dr. K Gireesh. That's myself. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. In this, the question that I'm addressing, what are the common neurological manifestations of HIV infection? The common neurological manifestations, the clinical manifestations of those, as well as the imaging findings, series of ancillary and treatment in an outline I'll be telling. What are the neurological consequences of a primary HIV infection? Acute retroviral syndrome. The clinical manifestation is that of an aseptic meningitis or a cranial neuropathy or a polyradiculopathy or acute inflammatory demyelinating polyradiculoneuropathy. Any one of these. The imaging findings are usually normal. Meningeal enhancement may or may not be there. The CF of findings, there will be a lymphocytic pleocytosis. And we have a cytoalbumogenic dissociation in case of AIDP. The tests are the electrical studies connected with neuropathic diseases can be done. And symptomatic medication and neuropathy immune modulation can be given, especially for acute immune demyelinating polyradiculoneuropathy or AIDP. The second one, apart from acute retroviral syndrome, the other manifestation is the HIV-associated neurocognitive disorders. A gradual decline in cognition occurs in adults, and there is a development and delay, often progressive in children. The imaging findings are progressive atrophy with periventricular white matter changes. Mild elevation of the protein will be seen when you do a CSF study, and lymphocytic pleocytosis. There will be a diffuse slowing on the EEG. And, the treatment, of course, ART, that is antiretroviral treatment, is to be given for these patients. The third manifestation is a CD8 plus HIV-associated encephalitis. It's an acute encephalitis with focal findings. And imaging findings, white gray matter lesions with subtle enhancements will be seen. And CSF pleocytosis in CSF studies. And corticosteroids is a treatment for that. The other manifestation is a myelopathy, that is spinal cord involvement. You get a spasticity and a weakness, a sensory ataxia with incontinence in these patients. And imaging findings will be a cord atrophy or a high signal intensity lesion on T2 weighted images. The CSF output will be in normal or slightly elevated protein levels of seen with a pleocytosis. And abnormal somatosensory evoked potentials are seen, especially when the posterior column is involved. And the treatment is again ART, of course, with steroids. Stroke is another thing that can occur, an acute neurological state consistent with stroke. Findings consistent, the imaging findings will be consistent with that of a stroke. Will be a vessel blockage with an infarction. And the CSF studies in such patients will be normal. And you do find the treatment will of course be again ART and rehabilitation. Myopathy you can get, that is a muscle disease. Proximal weakness more than the distal weakness. And imaging findings will be normal, and the CSF studies will be normal, and there might be a reduced nerve contraction in these patients. And myopathic changes are seen in the EMG, and immune modulatory therapies can be given. That is in fact the treatment for this. So, the neurological consequences of a primary HIV infection include acute retroviral syndrome, HIV-associated neurocognitive disorder, CD8 plus HIV-associated encephalitis, myelopathy, stroke, and myopathy. These are the complications that can occur. The key takeaways are HIV, human immunodeficiency virus, can affect the nervous system directly as well as indirectly via increased risk of nervous system infections, malignancies, and immune-mediated syndromes. HIV-associated neurocognitive disorder is a demanding illness due to direct central nervous system injury from HIV. CD8 plus encephalitis and tumefactive demyelination are two immune-mediated HIV-associated CNS complications. HIV can affect the peripheral nervous system, causing neuropathy and myopathy. Incidence of CNS infection by parasites, especially Toxoplasma, most often manifesting radiographically as enhancing lesions in the brain, and this is increased in patients with HIV infection. Then there is a risk of developing meningitis due to fungal Cryptococcus neoformans, and is elevated in patients with HIV infection. Patients with HIV infections are at greater risk for developing other viral infections of the CNS, including those caused by the JZ virus and cytomegalovirus. HIV infection increases the risk of developing CNS malignancies like primary CNS lymphoma, and this is often associated with Epstein-Barr virus in this patient population. Treatment of HIV infection with antiretroviral therapy may be associated with an immune reconstitution inflammatory syndrome that can affect the CNS. That is, those who are getting antiretroviral treatment can also have complications. So that's indeed the neurological manifestations of a primary HIV infection. Thank you. Thank you very much.